Hi everyone, my name is Fimi and welcome to my channel. Today we're going to be talking about the OSCE. OSCE is just an abbreviation for Objective Structured Clinical Examination. In layman's terms, that means that's a practical exam that you have to write here in the UK in front of an assessor. So all this while in your process of trying to become a UKRN, you've done the IELTS, you've done the CBT. Those are mainly like paper written exams. Now you have to do like a practical exam to show the UK Council or the NMC Council that you can perform some certain skills that will qualify you to be a nurse. The OSCE consists of 10 stations. 4 of these stations will be testing your ability to assess, plan, implement and evaluate the care of a patient. So basically, you will be given like a scenario or diagnosis, and based on that diagnosis and your patient and the signs and symptoms that your patient is manifesting, you will be asked to assess that patient, plan the care plan, implement and evaluate the care of that patient. Another 4 stations will be evaluating your clinical skills, and the last 2 stations are for things called professional values and evidence-based practice. The first 4 stations is basically the API stations. That is assessment, planning, implementation, and evaluation of a patient. In assessment, you'll be asked to carry out an A to E assessment of a patient. A to E meaning airway, breathing, circulation, disability, and exposure. Depending on your center, you might get a live patient or you might get a mannequin, and you'll be asked to assess that patient. For planning, you'll be asked to create care plans for that patient based on the diagnosis or the clinical signs and symptoms that that patient is manifesting. And in the implementation stage, it's more likely that you'll be implementing a particular care, and most likely you'll be administering oral drugs to the patient. In evaluation, you'll be assessed on how well you can transfer a patient or discharge a patient. So you are likely going to be handing over a patient to your assessor, and you'll be asked to use the SBAR technique. So SBAR meaning you'll be asked to use situation, background, assessment, and recommendation. What are the likely scenarios or diagnoses that come up in the API station? Based on your specialty, so that means whether you're an adult nurse or you're a learning disability nurse or you're like a midwife or mental health nurses, the scenarios vary from specialty to specialty. For adult nursing, these are the scenarios that might come up in your OSCE for the API stations. You could be asked to assess a patient with Alzheimer's disease, anxiety and depression, asthma, chronic heart failure, and be asked to do a community assessment, ectopic pregnancy, end of life, fall and fracture, hernia, homelessness, pneumonia, or subdural hematoma. Another 4 out of those 10 stations will be assessing you on how well you can carry out clinical skills. Depending on what specialty, the clinical skills also vary. If you are an adult nurse, most likely these are the possible clinical skills that might come up. You might be asked to administer inhaled medication, administration of suppository, blood glucose monitoring. You might be asked to carry out a bowel assessment or obtain a specimen from a catheter, that is catheter specimen of urine. You might be asked to pass a fine bore NG tube, calculate fluid balance, do an in-hospital resuscitation, administer intramuscular injection, give an IV flush and also give a VIP score, nasopharyngeal suctioning, nutritional assessment, and an oral care plan. The last 2 stations are basically for things called professional values and evidence-based practice. They are silent stations and involve more of writing. For example, in professional values, you'll be given a scenario and you'll be asked, as a professional acting according to the NMC Code of Conduct, what would you do in this certain kind of scenario? And scenarios that can come out for professional values include bullying, concealment of birth status, confidentiality, drug error, false representation, falsifying observations, falsifying timesheets, hospital food, impaired performance, laboratory results, possible abuse, professional confrontation, racism, social media, and witness abuse. In evidence-based practice, possible scenarios that can come out are ankle sprain, autism spectrum disorder, bedside handover, cervical screening, cranberry juice and UTIs, dementia and music, diabetes, female myocardial infarction symptoms, fever in children, obesity management, pressure ulcer prevention, restraint, saline versus tap water, smoking cessation, and honey dressing in venous leg ulcers. Now, let's look at the cost of the OSCE. The OSCE costs about £794. Depending on your contract, for example, if you are coming in from the overseas and a hospital or an employer is bringing you over. If your contract states that your employer is going to sponsor your Husky, your employer will be the one who is going to pay for your Husky and carry out your Husky plans. But if your contract says otherwise and says that you are the one who is going to personally pay for this, then you would have to pay for this. That's the £794 out of your own pocket. If you should fail the Husky, that means you fail in 7 or fewer stations. That is, if you fail 1 station, 2, 3, 4, 5, 6, 7 stations, you can come back and rewrite the stations. That means you don't have to rewrite all the stations. You just come back and rewrite those ones that you failed. But you would have to pay half the price, and that's £397. However, if you failed 8 stations or more than 8 stations, you will have to pay the full price to rewrite the Husky. If you fail the Husky a maximum of 3 times, you would have to restart your NMC application all over. That means your NMC application will be cancelled and you will start all over by applying for the NMC, submitting your verification, writing IELTS again, writing CBT again, and then applying for the Husky. And you'll be asked to give a gap of 6 months before you can rewrite the Husky again. Bear in mind these things when you're negotiating a contract with an employer. Before you sign that job contract, know the things that your employer is going to do for you and the ones that they say that they are not going to do for you. Most likely, if your employer is bringing you over to the UK, they will be the ones to make any preparations you need for Husky. And currently in the UK, we have 5 test centers. We have one in the Oxford Brookes University, we have one in the University of Northampton, we have one in Ulster University, and one in Northumbria University, and the last in Leeds Teaching Hospital NHS Trust. Depending on how soon you can get a space or slot, or your employer can get one for you, you might not write Husky immediately you come into the country, or you might write it as soon as you get into the country. So here are some tips to help you pass the Husky. The first thing I want you to remember is that you've probably done most of these skills before. The only thing is that you're probably in a new country and you're doing it in front of an assessor. And I know that the very presence of an assessor can be very nerve-wracking, but I want you to try to relax. Even though I know you cannot be fully relaxed, but try to be as calm as you can get. It will be very helpful when you're writing the exam. Depending on your center and depending on what skills you'll be getting, sometimes you might get a live patient or you might get a mannequin. Whichever way, I want you to interact with the patient or the mannequin as you would a normal patient. If you make a mistake, don't panic. Tell the assessor within the allocated time frame what you would do to correct that mistake. So you can go and say something like, Mr. Assessor, I realize I did this, or I think that's wrong and this is what I would do to correct what I've done. Ensure that you finish everything within the allocated time frame. Most likely, your assessor will prompt you like 3 minutes or 5 minutes to the end of the time that you have 3 minutes left or you have 5 minutes left. So that lets you know that, oh, I have 5 minutes left. What is it that I have not done in this skill? Or what is it that I have not done in this station? Try to finish everything because everything is important. Verbalize everything you are doing. Don't assume that the assessor is looking at you. If you are going to touch the patient, say, Mr. Assessor, I'm approaching the patient and I'm going to touch. If you are going to flush the line, maybe in VIP score, say, Mr. Assessor or Miss Assessor or whoever the person is, I'm flushing the line. Learn to verbalize your skill. It really helps a lot. Don't just assume that, oh, the assessor is here, he or she is looking at me. Make sure that every single thing that you are doing, you are verbalizing and saying it. I know it sounds weird, but it's very critical for this exam. Familiarize yourself with every possible scenario or diagnosis for API and every possible skill station. Also the ones for professional values and evidence-based practice. Familiarize yourself with the observation charts, with the medication charts, with the equipment, even things as little as apron. Familiarize yourself with how to open the apron and how to wear it as fast as you can. Don't assume that you will not get a particular station and be like, oh, I don't think I'm going to get this particular scenario. It might shock you. That might be this particular scenario that you get. And what are you going to tell the assessor? Mr. Assessor, I did not prepare for this scenario. Can you give me another one? That is a fail. And you're going to come back and rewrite that exam. So prepare and familiarize yourself with every single thing. Prepare for things as cold. So if you're going to be writing your exam in the winter and you're someone who detests cold, wear like a sweater or something warm under your uniform or whatever it is you're going to be wearing for the exam day. Writing an exam is already nerve-wracking, and out of all the problems you can have on your exam day, don't let cold be one of them. and also hunger. Don't let hunger be your problem on that day. As soon as you enter the exam and you start your exam, you won't be allowed to go out until the end of your exam, and you don't want your stomach to be rumbling or you are feeling hungry while you are writing the exam. Except maybe you are religious and you're trying to fast towards that day. This tip was actually given to me by the people who helped me prepare for my own OSCE. And the tip is never clock out. Let your assessor be the one to clock you out or tell you that the time is up. Use every bit of your time, every second. Go over that skill again and again and again. You might think you said it all, but when you are going over something, you may remember, oh, I haven't said this, and then you have the opportunity to say it. But once you clock out and you tell the assessor that you are finished and you are done with that skill, you can't go back and correct any mistake. But if you still stay and you go over everything you've done, you look at everything you've done, something might come to you and say, oh, I think I've not done this. Let me quickly say it. You get. And this tip is very important. Practice a lot. I cannot overemphasize how important this is. Practice and practice a lot. Also, if you can, practice with friends. If you don't have any friends, find someone to practice with. Let them see you carry out the skills. One of your friends can hold the marking criteria and watch you carry out that skills. Let them critique you. Let your friends critique you while you're carrying out your skills or while you're carrying out your API stations. You never know what you might not see while you're practicing alone. Your friend might see it while you're practicing with them. And also, while you're practicing, whether alone or with your friend, try and use a marking criteria. A marking criteria will guide you. A marking criteria will state these are the things that are important, that must not be left out. These are the mistakes that should not be made. These are the things that you do. If you do them, it will be a fail. And these are the things that must not be left out for you to pass. That's how important a marking criteria is. You're just going to come here to the Google browser and type in NMC UK, and there we go. You're going to come here to their website, the Nursing and Midwifery Council. If you come here to the search button, we're going to search for OSCE. And here we have it, OSCE. You can see there's tons of information about OSCE on their page, their approved centers, the new structure for the 10 stations and things like that, the fees, yeah, and all that you can get on their page. So if you click on one of these centers, let's click on Oxford Brookes University. When you come to their website, you'll be able to find more information about the OSCE on it. Let's go to preparation and support. So as you can see here in support, you see how to prepare for your OSCE, test of competence 2021 downloads. So if we come here to test of competence 2021 downloads, you click on this, you see all disciplines and lots of information about it. How to prepare for your OSCE, CBT information booklet, OSCE information booklet. We come here to nursing station timings. So as you can see here, you can see all the nursing stations, whether it's for adult nursing, whether it's for mental health nursing, whether it's for learning disabilities or children nursing. These are all the possible skill stations that you can get, whether it's for adult nursing, every specialty, and these are what you can get for evidence-based practice, and this is what you can get for professional bullying. And by the side here, you can see duration. Yeah, it shows you how many minutes is professional values going to last, and this is going to last for about 10 minutes. If you come here to the skill stations, you can see how many minutes each station is going to last. And if you come here to OSCE supporting documents, it shows you all the charts that you can come across, like the news chart, the Glasgow Depression Scale Questionnaire, malnutrition universal screening tool, that's the MOS score, pain assessment tool, the breathing risk assessment, fluid balance charts. So you can come here and download, all these charts and use it to prepare for your OSCE. And if you come down here to adult nursing, you can see RN1 adult nursing marking criteria. If you click on that so as you can see, this is the marking criteria for all the stations. You can print this out and use it to practice by yourself or with your friends. So you can see here, if you come to API, the assessment criteria tells you here that you have to assess the safety of the scene and the privacy and dignity of the patient. The criteria just shows you these are the things that you should not miss in every step. If you miss it, you might likely get a fail, or you might have to come resit it. And same, you can see there's a criteria for every specialty: mental health nursing, learning disability nursing, children's nursing. And here is just the equipment list. I think this just tells you like the equipment you are likely to come across when you are doing your OSCE, and so that you can just familiarize yourself with them. Yep, and that's it. So if we go back to the NMC website, I would advise you, like maybe your center is the Oxford Brookes University, you can come here, click on their page and find out more about the OSCE and the things that will be required in their centers. If yours is University of Northampton, you can come here and click on their page and find out more about the resources that they have available for you. There are certain YouTubers whose videos or whose channels are dedicated to OSCE preparation. One is Arl Bautista. I hope I'm pronouncing it right. She has some videos on her channel that are dedicated towards OSCE. Another YouTuber that I also watched while I was preparing for my own OSCE is Violet Okulucha. She also has resources on her page that will help you prepare for your OSCE. You can also watch out for other YouTubers, but be careful that whatever page you are following or whatever resources you are using is not dedicated towards the old OSCE. Make sure that the resources are dedicated towards the new OSCE. And I wish you the very best in your preparation. I pray or I hope that you sit once and you pass once. Preparation for OSCE can be very nerve-wracking, I tell you. The fact that you have to do a skill or you have to prove yourself in front of another person while the person is watching is very nerve-wracking. I hope you sit for it once and you pass it once. All the best.